Good evening, everybody. I am Dr. Kaushik here. I am consultant hematologist, hemato-oncologist, as well as bone marrow transplant physician, and I am working at Suraj Gupta Cancer Center and Research Institute, Kolkata, which is also known as Thakur Pukur Cancer Hospital. Today, we will discuss about one of the blood malignancies that is called multiple myeloma. So, why we are discussing about multiple myeloma today? Basically, this month is a multiple myeloma month. So, what is multiple myeloma? Multiple myeloma is a kind of blood malignancies where there is excessive expansion or proliferation of plasma cells in our body, which is normally present in our body or in bone marrow very insignificant amount. So when there is excessive proliferation of these plasma cells occurs, or there is excessive expansion of these plasma cells occur in our body, then it lead to physical consequences which are very harmful to our body. So multiple myeloma patients generally come to us with complaining of recurrent anemia that is leading to recurrent blood transfusion, raised creatinine level, or there is chronic kidney disease, or there is acute kidney injury in the background of chronic kidney disease. Peripheral neuropathy like tingling and numbness sensation, or paresthesia we call generally, tingling and numbness sensation of the limbs. It can be upper limb, it can be lower limb, or it can be both. There is pathological fracture. What is pathological fracture? There is spontaneous fracture of the bones, of different bones in our body. Another word, very important clinical presentation is that recurrent anemia along with recurrent chest infection. So, these are the basic common clinical presentation when multiple myeloma generally in our body gradually develops. So, how to investigate for? When the patient is requiring repeated blood transfusion, when there is pathological fracture, when there is tingling and numbness sensation, when there is recurrent chest infection, when there is kidney disease newly developed, then we have to proceed accordingly. So first, to go for complete blood count as well as reticulocyte count, and for anemia, nutritional deficiencies have to rule out. For this, serum iron profile and B12 folate level is mandatory. After that, serum calcium level, serum creatinine level, serum LDH level, as well as skeletal surveys, especially X-rays or MRI of hip, shoulder, skull, or bones where the painful crisis or painful episode occurs, whether there is any fracture is going on or not, to rule out this. After that, we have to go for serum protein electrophoresis, immunofixation electrophoresis, and serum free light chains, as well as beta-2 microglobulin, which is a prognostic marker of multiple myeloma. So, if all these basic investigations is suggestive of multiple myeloma, then we have to proceed for bone marrow workup, bone marrow aspiration, bone marrow biopsy, as well as FISH for myeloma pattern, to know the risk group of this disease. So, what are the risk groups? As I have discussed, all the investigations, according to these investigations, we classify multiple myeloma as standard risk group, intermediate risk group, and high risk group. So, in standard risk group, basically the 5-year overall survival rate is nearly 80%. And in intermediate risk group patients, generally having 5-year overall survival of 60%. And in high risk group patient, generally the 5-year overall survival is not reached. Basically, multiple myeloma occurs in elder age group mostly, but nowadays we are seeing that it occurs in young ages also. So for treatment by purpose, nothing to worry about, very simple treatment, and according to updated guidelines, so many newer molecules and newer drugs have come out, which is to be very effective for the treatment point of view. So in case of standard risk group or intermediate risk group, we should proceed for chemotherapy based treatment along with few oral medications, which are oral chemotherapy drugs, along with few antiviral as well as antibacterial prophylaxis. For high risk group patient, it's quite different ballgame. It's basically a disease where in high risk group patients, without doing bone marrow transplant, there is very less possibility that disease will remain at stable phase. So after giving 4 cycles of therapy, we generally proceed for autologous bone marrow transplant if age permits or patient's performance status is very good and comorbid conditions are not so clinically significant. So according to all this, definitely we should plan for the therapy, and if these symptoms occur, you please come to physician and discuss. After proper consultation and investigation, definitely the cause or the diagnosis of the disease will come out. But don't delay, because multiple myeloma, if treated early, definitely the disease can remain in stable phase. And after if you come late to us or without any consultation of the physician, it can be very dreadful disease. So this is all about multiple myeloma.